Welcome to an overview of Divisions of Family Practice. This presentation will cover a brief history of primary care in BC and overviews of the General Practice Services Committee, Divisions of Family Practice, and A GP for Me, the Attachment Initiative. Let's start with a brief history of primary care in BC. Primary care is frontline care usually delivered by family physicians and is often the point where patients enter the health system. In the year 2000, primary care in BC was in trouble. Medical students weren't choosing family medicine, and doctors were leaving full-service practice or leaving family practice altogether. There were four main reasons for this. First, doctors were undervalued. Primary care wasn't receiving much needed attention from the medical community and the government. Second, they were underpaid, compared with specialists, senior managers, and business executives. Third, they were overworked, typically seeing patients all day and updating medical charts in the evenings. Vacations were impossible because there was no one available to cover for them. And fourth, they were isolated. For example, a doctor could go years and not meet other doctors working in the same building. They were simply too busy running their own practices and didn't have time. If we fast forward a decade, enrollment at medical schools in family practice is beginning to increase, and research shows that BC's family physicians are happier in their jobs than they were 10 years ago. What happened in those middle years? In 2002, the provincial government's Ministry of Health Services and the BC Medical Association partnered to form the General Practice Services Committee, or GPSC. The committee first met in January 2003 as a trial effort to improve patient care and physician satisfaction in BC. The BC government committed to funding the GPSC through an allotment of approximately $800 million over 6 years. This is a significant step in rebuilding family practice in BC. The committee is made up of Ministry of Health Services officials, family physicians, the BC Medical Association, and representatives from health authorities throughout the province. The key role of the GPSC is to encourage and enhance full-service family practice to benefit patients. Since its inception, the GPSC has developed 4 programs. The Family Practice Incentive Program supports and compensates family physicians for delivering guideline-based patient health care in such areas as chronic disease management, maternity care, mental health, and care for the frail and elderly. The Practice Support Program helps family physicians by offering evidence-based, focused training strategies through learning sessions and in-office action periods with a GP mentor to help improve practice efficiency and enhance delivery of patient care. CHARD, the Community Healthcare and Resource Directory, is a free, secure web-based directory for healthcare providers and their assistants. And Divisions of Family Practice, developed by the GPSC in 2008 to help family physicians work together to improve healthcare in communities across BC. Physicians have typically been isolated, working in their own practices with a small office staff and at a pace that leaves little extra time for networking, attending conferences, or meeting other doctors. They're too busy caring for patients. Through Divisions of Family Practice, physicians now have a stronger collective voice and more impact in their community. At the same time, they receive support collectively and individually to improve their clinical practices, offer comprehensive patient services, and influence health service decision-making in their community. Divisions of Family Practice are groups of physicians organized at the local or regional level and are developed in communities where physicians wish to establish one. Doctors are compensated by the GPSC to take part in the divisions. Here's how it works. Each division will have a collaborative services committee, which is made up of representatives from the Ministry of Health Services, the GPSC, and the local health authority. When division physicians have identified a patient care issue or a problem in the community that requires the partners to participate, they meet with their local collaborative services committee. Division doctors work together as an equal partner with the other representatives. The partners work collaboratively, which is in stark contrast to the previous top-down approach. All partners discuss the issue and develop solutions to address it. The solution may be something that's resolved by better coordination of services and resources. It may require a small amount of project management and change management support, or it may require a new clinical service agreement. Whatever the solution, its foundation rests on good faith, solid relationships, and a commitment to the triple aim: improved experiences for both patients and family doctors, improved health of the population, and a more sustainable healthcare system. The Collaborative Services Committee can also invite the community into discussions and planning. This is an opportunity for municipal leaders, community groups, and nonprofit societies to get involved and make sure the groups aren't duplicating services or working at cross purposes. Divisions are located in communities throughout the province. The work to fix primary care is taking place all over BC. A GP for Me, the Attachment Initiative, is funded through the General Practice Services Committee. This initiative aims to ensure that all British Columbians who want primary care have access to a family physician, and to better support and reward family physicians who are committed to delivering long-term care for their patients. Currently, thousands of British Columbians do not have a family doctor or don't have a strong attachment to a family doctor. Research has shown that the strength of the bond between a patient and a family physician is directly related to better health outcomes for patients, greater satisfaction for physicians, and lower costs to the healthcare system. Physicians in local divisions of family practice will lead the work to ensure residents of their community have access to the benefits of primary care. 3 initial division prototypes have been selected to undertake a GP for Me. It's expected that up to 36 divisions will participate in a GP for Me by March 2015. Each participating division will work closely with its regional health authority, municipality, and community groups to create locally appropriate, collaborative strategies to ensure that all residents of a community have access and deeper attachment to a primary care provider. Overall, our goal is to ensure that both patients and physicians have improved experiences within the healthcare system, that residents of British Columbia are healthy, and that BC's healthcare system is sustainable for the future. For more information, go to www.divisionsbc.ca.